10 early warning signs of heart disease you should never ignore. Have you ever wondered if your body could be trying to warn you about heart disease long before a heart attack happens? The truth is, it often does. The problem is that many of these warning signs seem so ordinary that people blame them on stress, aging, lack of sleep, or simply being out of shape. They ignore them for weeks, months, or even years. Heart disease remains one of the leading causes of death worldwide. But here's the encouraging news. Many serious heart problems don't happen without warning. Your body often gives subtle clues that something isn't right. Recognizing these signs early and getting medical advice could make a huge difference. In today's video, we're going to explore 10 early warning signs of heart disease that you should never ignore. Some of them may surprise you because they don't always involve chest pain. Make sure you stay until the end, because the final warning sign is one that many people dismiss as completely harmless. Before we begin, if you enjoy simple, science-based health advice that can help you live a longer and healthier life, please take a second to like this video, subscribe to the channel, and turn on notifications so you never miss our latest heart health tips. The first warning sign is chest discomfort. When most people think about heart disease, they immediately imagine severe chest pain. While that can happen, early heart-related chest discomfort is often much more subtle. Some people describe it as pressure, tightness, squeezing, heaviness, burning, or even a feeling that someone is sitting on their chest. Others say it feels like indigestion that won't go away. The discomfort may come and go. It may appear during physical activity, climbing stairs, carrying groceries, or emotional stress. Sometimes it disappears after resting. This happens because the heart muscle may not be receiving enough oxygen-rich blood due to narrowed coronary arteries. One common mistake people make is assuming it's just heartburn or muscle soreness. While indigestion is common, chest discomfort that keeps returning, especially during activity, deserves medical evaluation. Imagine a person who notices chest pressure every time they walk uphill, but feels fine after sitting down for a few minutes. They may think they're simply getting older, but this pattern can be an important warning sign that the heart is under stress. If you've experienced something similar, let us know in the comments. Your experience might encourage someone else to take their symptoms seriously. The second warning sign is shortness of breath. Have you recently found yourself getting winded while doing activities that never used to be difficult? Maybe climbing one flight of stairs suddenly feels exhausting. Perhaps walking your dog leaves you unusually breathless. Or maybe you wake up at night feeling like you can't catch your breath. When the heart isn't pumping efficiently, fluid can build up in the lungs, making breathing more difficult. Many people mistakenly blame this on aging, being out of shape, or gaining a few extra pounds. While those factors can contribute, sudden or unexplained shortness of breath should never be ignored. A simple example is someone who has walked the same neighborhood route every evening for years. Suddenly, they have to stop halfway because they're struggling to breathe. That's a noticeable change worth discussing with a healthcare professional. The next warning sign often catches people completely off guard. The third warning sign is unusual fatigue. Everyone feels tired sometimes. Busy schedules, poor sleep, and stress affect all of us. But heart-related fatigue is different. People often describe it as overwhelming exhaustion that doesn't improve with rest. Even simple daily activities like making the bed, taking a shower, or shopping for groceries can suddenly feel difficult. When the heart can't pump blood efficiently, the muscles and organs receive less oxygen and nutrients. As a result, your body has to work harder to perform everyday tasks. Some individuals, particularly women, may experience unusual fatigue weeks before a heart attack. That doesn't mean every episode of tiredness signals heart disease. However, if your energy level changes dramatically without an obvious explanation, it's worth paying attention. Think about someone who has always enjoyed gardening every weekend, but suddenly feels completely drained after just a few minutes outside. That unexpected decline deserves attention rather than being dismissed as normal aging. Small changes often tell an important story. Now, let's talk about another symptom that many people don't associate with the heart at all. The fourth warning sign is pain that spreads beyond the chest. Heart discomfort doesn't always stay in one place. It can travel to the shoulders, arms, neck, jaw, back, or even the upper stomach. For some people, especially women, older adults, and people with diabetes, pain in these areas may be the only noticeable symptom. The discomfort may be dull, aching, burning, or feel like pressure rather than sharp pain. One classic example is discomfort that starts in the chest and spreads down the left arm, but symptoms can also affect the right arm or the jaw. Because these symptoms seem unrelated, people often visit a dentist for jaw pain or blame shoulders discomfort on sleeping in the wrong position. While muscle pain is common, pain that appears during physical activity, emotional stress, or alongside other symptoms like shortness of breath or sweating should be evaluated promptly. Your body rarely follows a textbook pattern, so don't ignore unusual combinations of symptoms. Now here's another warning sign that often seems too simple to matter. The fifth warning sign is dizziness, lightheadedness, or fainting. Have you ever stood up and suddenly felt like the room was spinning? Occasional dizziness can happen for many reasons, including dehydration or standing up too quickly. However, repeated episodes of dizziness, feeling faint, or actually losing consciousness may indicate that the heart isn't pumping enough blood to the brain. Heart rhythm problems, known as arrhythmias, can sometimes reduce blood flow temporarily. Some people notice episodes where they suddenly become weak, pale, or feel like they might pass out during exercise or even while sitting quietly. Imagine someone mowing the lawn who suddenly has to stop because they feel dizzy and unusually weak. That experience deserves medical attention rather than simply drinking water and forgetting about it. If dizziness occurs together with chest discomfort, shortness of breath, or palpitations, seek immediate medical care. We're halfway through our list, and the next signs are often overlooked because they're easy to explain away. The sixth warning sign is swelling in the legs, ankles, or feet. Have you noticed that your shoes suddenly feel tighter by the end of the day? Maybe your socks leave deep marks around your ankles. Swelling can occur when the heart isn't pumping blood effectively, allowing fluid to accumulate in the lower parts of the body. This doesn't automatically mean heart disease. Swelling can also result from standing for long periods, certain medications, kidney disease, or other medical conditions. The important point is persistence. If swelling becomes frequent, worsens over time, or appears alongside shortness of breath and fatigue, it should be evaluated. A good habit is paying attention to changes rather than isolated events. If your rings, shoes, or clothing consistently fit differently because of swelling, don't simply ignore it. Many people think swelling is just a normal part of getting older, but that's not always true. The seventh warning sign is an irregular heartbeat or heart palpitations. Most of us have experienced a brief flutter in our chest after drinking too much coffee or during a stressful moment. Occasional palpitations are common. However, frequent episodes where your heart races, skips beats, pounds forcefully, or feels completely out of rhythm deserve medical attention. Certain heart rhythm disorders can increase the risk of stroke, heart failure, or other complications if left untreated. Some people describe the feeling as a fish flopping inside their chest. Others say it feels like their heart suddenly starts sprinting for no reason. Keeping a record of when these episodes occur can be helpful. Do they happen during exercise? After alcohol? While resting? Sharing this information with your healthcare provider can make diagnosis easier. Have you ever experienced heart palpitations? Tell us about it in the comments. And remember that persistent or severe symptoms should always be discussed with a medical professional. Now let's move to a warning sign that's often mistaken for a completely different health problem. The eighth warning sign is nausea, indigestion, or stomach discomfort. Many people are surprised to learn that heart problems don't always feel like heart problems. Instead, they may cause nausea, bloating, stomach pressure, or what feels like severe indigestion. This is especially true for women, older adults, and people with diabetes. The key is noticing the context. If stomach discomfort occurs during physical activity or emotional stress, especially alongside sweating, chest discomfort, or shortness of breath, it should not be ignored. For example, someone may finish dinner and assume their discomfort is simply heartburn, but the symptoms continue despite medication and become worse while walking. When symptoms are unusual, persistent, or different from your normal digestive problems, seek medical advice. It's always better to have symptoms evaluated than to assume they're harmless. The ninth warning sign is excessive sweating without a clear reason. Sweating after exercise or on a hot day is perfectly normal, but suddenly breaking into a cold sweat while sitting still, resting, or doing light activity can be an important warning sign. Many people describe feeling clammy, pale, or unusually sweaty even though the room isn't warm. This symptom often occurs alongside other heart-related symptoms, but not always. Imagine sitting quietly, watching television when you suddenly become drenched in sweat for no obvious reason. That unexpected change shouldn't be ignored, especially if it's accompanied by chest discomfort, dizziness, or nausea. Your body often reacts to heart stress in ways that don't seem obvious at first. Now we've reached the final warning sign, and it's one of the easiest to overlook. The 10th warning sign is reduced ability to exercise or perform everyday activities. Sometimes the earliest clue isn't pain, it's simply noticing that your body can't do what it used to do. Perhaps you become exhausted after walking a short distance. Maybe carrying groceries feels much harder than it did a few months ago. Or perhaps climbing stairs suddenly requires several rest breaks. Many people slowly adjust their lifestyle without realizing it. They stop taking walks. They avoid stairs. They park closer to buildings. They unconsciously reduce activity to avoid uncomfortable symptoms. Because these changes happen gradually, they often go unnoticed. One of the best things you can do for your heart is pay attention to changes in your own physical abilities over time. If your endurance has noticeably declined without an obvious explanation, don't simply accept it as aging. Discuss it with your healthcare provider so they can determine whether your heart or another medical condition may be involved. Before we wrap up, it's important to remember one very reassuring message. Having one of these symptoms does not automatically mean you have heart disease. Many of these warning signs can have other causes that are far less serious. However, persistent, recurring, or worsening symptoms deserve professional medical evaluation. Never ignore symptoms that are severe, occur suddenly, or happen together. If someone experiences chest discomfort along with shortness of breath, pain spreading to the arm or jaw, nausea, dizziness, or cold sweating, seek emergency medical care immediately. Early action can save heart muscle and, more importantly, save lives. The good news is that many cases of heart disease can be prevented or managed through healthy lifestyle choices and appropriate medical care. Simple habits make a remarkable difference over time. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports heart health. Regular physical activity strengthens the heart and improves circulation. Managing blood pressure, cholesterol, blood sugar, and maintaining a healthy weight all reduce cardiovascular risk. Get enough sleep, avoiding tobacco, limiting alcohol, managing stress, and attending regular health checkups are also important parts of protecting your heart. Remember, heart health isn't about being perfect. It's about making consistent, sustainable choices every day. Let's quickly review today's 10 early warning signs: chest discomfort or pressure, shortness of breath, unusual fatigue, pain that spreads to the arms, jaw, neck, back, or shoulders, dizziness or fainting, swelling in the legs, ankles, or feet, irregular heartbeat or frequent palpitations, nausea or unexplained indigestion, cold sweats without an obvious reason, and a gradual decline in your ability to perform everyday activities. The sooner these warning signs are recognized, the sooner appropriate medical care can begin. Your heart works tirelessly every second of your life. Taking care of it today can help you enjoy many healthier years ahead. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on notifications so you never miss our future heart health videos. Share this video with your family and friends because one conversation could encourage someone to recognize a warning sign they might otherwise ignore. And before you go, we'd love to hear from you. Which of these warning signs surprised you the most? Have you or someone you know experienced any of them? Leave your thoughts and questions in the comments below. We read as many as we can, and your story may help someone else take their heart health more seriously. Thank you so much for watching. Stay healthy, take care of your heart, and we'll see you in the next video.